Our intent was to analyze in the real-world setting how these novel therapeutic cells can be manufactured. We know from the clinical studies that there have been some problems in manufacturing where cells could not be released, either because they did not grow or because they did not achieve release criteria. In clinical studies, we normally do not use so-called out-of-specification products because we cannot keep the patient in the study as the drug is not the proper one the companies want to analyze. So in the real-world setting, we are dealing with kind of different patients. Normally, those patients do not achieve inclusion criteria for the studies. They are probably older or have higher ECOG status or have a longer history of disease. And we were interested in how the production in these patients is going. And therefore, we analyzed or sent out a survey to the EBMT centers who do register data on CAR-T cell patients who receive CAR-T cells in a commercial setting. So we sent out the survey to 202 centers, and the response rate was as usual, not 100%, it was 31%. So this is a good response rate for us. And what we found is that pretty similar to clinical studies, the manufacturing failures in the CD19-targeted CARs are approximately 4%. However, in BCMA-targeted CARs, which are more recently on the market for the treatment of multiple myeloma patients, are higher as reported in clinical studies. They are 7%. This can be because those patients in Europe had a long time to wait for this product. So we, for example, in Austria, we got the product last December, whereas in other countries, it is already 2 years on the market. So this maybe reflects a higher level of pretreatment. And also in myeloma patients, different drugs are used during the first line and salvage therapy than in lymphoma patients. So therefore, there is a difference. What we also found out is that the out-of-spec products are similar in the lymphoma patients, like manufacturing failures, but are higher in the myeloma patients. So for that, our next step would be to go back to those centers reporting these failure rates or out-of-spec products and to analyze more in depth the patient's history to maybe find out which parameter influences failure rates or out-of-spec products. And what we also want to know is whether the outcome of patients receiving out-of-spec products is comparable to those patients who have received products in spec. Yeah, and one important analysis has been already done by the UK colleagues who analyzed a smaller cohort of patients, but they found also that out-of-spec products may have a less potent response of the disease.